What if the next major C-suite role in healthcare isn't the Chief Medical Informatics Officer, the CMIO, but the Chief Medical Artificial Intelligence Officer, the CMAIO? It's not a futuristic concept, it's a present-day reality. As AI rapidly moves from the lab to the bedside, a new form of leadership is required to navigate its immense promise and profound risks. Health systems across the U.S. are already appointing them, creating roles like Chief AI Officer and Chief Health AI Officer. Why? Because AI is no longer a niche experiment. It's now touching the core of clinical practice. Our documentation, our diagnostic imaging, patient triage, hospital operations, and even population health strategies. With stakes this high, someone must lead the charge, ensuring these powerful tools are deployed safely, ethically, and effectively. And who are the leaders most qualified to guide this monumental transformation? The very people who have spent the last decade bridging the gap between medicine and technology, chief medical informatics officers, and the entire field of clinical informaticists. Their experience is the bedrock upon which this new role will be built. Before we dive deep into this evolution, if you're a clinician or leader navigating the digital frontier of medicine, hit that like button so this video reaches more of your peers. And be sure to subscribe for our weekly physician-led deep dives into healthcare AI. In this comprehensive guide, we'll cover the critical ground. First, we'll explore why CMAIO roles are emerging now. We'll define what a CMAIO actually does, breaking down their 5 core domains. We'll discuss the essential training and literacy required for the role. We'll walk through real-world AI examples in clinical practice. We'll provide a practical roadmap for how today's CMIOs can transition into this new function. And finally, we'll forecast when this shift will become mainstream across healthcare. Let's start with your perspective. In the comments below, tell me, do you think the CMAIO will become a standard C-suite role in most healthcare organizations within the next 5 years? Your insights are invaluable and help shape our future content. This isn't a theoretical discussion anymore. The pioneers are already here. Leading health systems are actively appointing chief AI officers, chief health AI officers, and chief medical AI officers. We're seeing this at institutions like Radiology Partners, Cleveland Clinic, Mayo Clinic, UCSF, Cedars-Sinai, and Sutter Health. These organizations recognize that without dedicated expert leadership, the risk of fragmented, unsafe, or ineffective AI implementation is simply too high. The CMAIO role has arrived. To paraphrase William Gibson, its future is already here. It's just unevenly distributed. For now, it's concentrated in large academic centers and forward-thinking health systems. But this is the leading edge of a wave that will soon reach every corner of healthcare. AI is no longer just a series of interesting pilot projects. It's rapidly becoming a core infrastructure layer, as fundamental as the EHR or the cloud. It's being woven into the fabric of healthcare across ambient documentation, clinical decision support, diagnostic imaging triage, administrative automation, predictive analytics for population health, care management, and even patient-facing virtual agents. When AI touches this many aspects of patient care, a critical question emerges: who is ultimately accountable for its performance, safety, and ethical use? That accountability gap is what the CMAIO is designed to fill. If you're finding this breakdown of the AI landscape useful, take a moment to press the like button. It's a small click that makes a big difference in helping this content get recommended to more physicians and healthcare leaders. In many ways, AI is reshaping medicine even faster than the EHR revolution did. Why? Because its impact is broader and deeper, affecting virtually every key performance indicator in a health system: clinical quality, patient safety, daily workflows, clinician burnout, operational costs, efficiency, and health equity. Without strategic oversight, AI can just as easily amplify existing problems as it can solve them. We are officially entering the AI-first era of healthcare, where technology strategy is inseparable from clinical and business strategy. This is precisely why CMIOs are perfectly positioned to evolve. For years, they have operated at the complex intersection of clinical practice, data infrastructure, provider workflows, clinical decision support, documentation standards, large-scale change management, and driving physician adoption of new technologies. The CMAIO role is not a replacement of this expertise, but a natural and necessary extension of it, applying those hard-won skills to the unique challenges and opportunities of artificial intelligence. So what does a CMAIO actually do? Their responsibilities can be organized into 5 critical domains. First, AI governance, establishing the rules of the road. Second, AI evaluation, rigorously testing tools before they touch patients. Third, workflow integration, ensuring AI fits seamlessly into how we work. Fourth, safety and ethics, protecting patients and providers. And fifth, enterprise AI strategy, creating a coherent vision for the future. Crucially, this is a leadership and strategy role, not a coding or data science job. This brings up a key organizational question, and I'm curious for your take. In your organization, who do you think should own AI governance? The CMIO, the CIO, the Chief Data Officer, or a new, dedicated CMAIO? Let me know your thoughts in the comments below. In the governance domain, the CMAIO is the architect of trust. They establish and lead the AI Governance Committee, which is a multidisciplinary body of clinicians, IT experts, legal counsel, and ethicists. This group is responsible for vendor validation, mandating external testing, and conducting thorough bias analysis. They ensure compliance with emerging frameworks like the NIST Risk Management Framework and FDA regulations, and their work doesn't stop at deployment. They oversee continuous pre- and post-deployment monitoring, watching for performance drift, and maintaining transparent audit trails. In essence, this is the organization's AI safety officer role. A brilliant AI model is useless if it disrupts care. That's why workflow integration is paramount. AI doesn't work unless the workflow works. The CMAIO is the master translator, ensuring that AI tools fit elegantly and intuitively into the complex realities of healthcare delivery. This means embedding them into clinical encounters, integrating them within the EHR, streamlining the physician inbox, simplifying documentation, augmenting imaging workflows, powering population health dashboards, and automating revenue cycle management. Success is measured by adoption and clinician satisfaction, not just model accuracy. A CMAIO is also the chief educator, responsible for building AI literacy across the entire organization. This isn't just for physicians. It extends to nurses, medical assistants, schedulers, administrative leadership, and the quality and safety teams. Every single person who interacts with an AI-powered system must have a fundamental understanding of what it does, how to use it correctly, and just as importantly, its limitations and how to use it. This education is the first line of defense against automation bias and other AI-related risks. Now here's the good news for aspiring clinical leaders. You do not need to be a data scientist or a machine learning engineer to be an effective CMAIO. However, you absolutely need to be literate in the core concepts. This includes understanding machine learning basics like supervised versus unsupervised learning, the fundamentals of how large language models work, the pernicious ways model bias can creep in, the FDA software as a medical device pathways, the principles of the NIST AI risk management framework, establish safety frameworks for implementation, and the concept of model drift, where an algorithm's performance degrades over time. Fortunately, world-class programs have emerged to build this exact skill set. For CMIOs and other clinical leaders, programs like Harvard's AI in Healthcare, the MIT Sloan AI Executive Program, Johns Hopkins Curriculum in Applied AI, the Mayo Clinic's AI Leadership Program, and the certification from the American Board of AI in Medicine are ideal. These are specifically designed for clinicians and executives, not engineers, focusing on strategy, governance, and implementation. Would a deeper breakdown of these specific training programs be helpful? If you want a future video comparing the curriculum, cost, and outcomes of each, tap the like button, comment below to let me know. A CMAIO must master the last mile of implementation, the gap between a promising algorithm and real-world clinical value. This involves designing and running effective pilots using plan, do, study, act cycles for rapid iteration, defining and tracking meaningful impact metrics, managing adoption curves to drive engagement, leading workflow redesign efforts, and establishing robust post-live safety monitoring. This is the domain of implementation science, and it's where experienced informaticists truly thrive. Let's look at a real-world example. Ambient documentation. These tools listen to the patient-physician conversation and automatically generate a clinical note, promising to reduce charting time by 30 to 70%. A CMAIO's role here is to lead the evaluation, asking critical questions. How accurate is the summary? What is the rate of clinically significant hallucinations? How is patient data protected and privacy ensured? And how does it integrate into the existing exam room and EHR workflow without creating new burdens? Consider AI in diagnostic imaging. Algorithms can now accelerate reading times, flag subtle abnormalities a human might miss, and improve triage for critical findings like intracranial hemorrhage or pulmonary embolism. Here, the CMAIO ensures a rigorous process for validation on the local patient population, not just the vendor's data. They oversee checks for demographic bias, design clear escalation pathways for AI-flagged findings, and implement continuous safety monitoring to catch any performance degradation. Predictive models that identify patients at high risk for sepsis, deterioration, or hospital readmissions hold enormous promise. But they can also be a double-edged sword. If a model is trained on biased historical data, it can systematically underestimate risk in certain populations, worsening health inequities. The CMAIO champions algorithmic fairness, ensuring that models are rigorously audited for bias and calibrated to perform equitably across all patient groups before they are used to guide clinical resources. What AI tools is your health system currently experimenting with or implementing? Share your experiences in the comments. Learning what's working and what isn't in other organizations is incredibly valuable for all of us. Beyond the clinic, AI is a powerful engine for operational efficiency. It can optimize hospital staffing, forecast patient demand, streamline surgical scheduling, and automate huge portions of the revenue cycle. This is where AI drives enormous measurable ROI. And that financial impact is precisely why CEOs and CFOs are now demanding CMAIO level leadership to harness this potential responsibly and strategically. So how do you start the transition? The first step is to get involved. Join, or if one doesn't exist, take the lead in building your organization's AI governance committee. Draft the charter, define the intake process for new AI tools. This work immediately becomes your CMAIO portfolio, demonstrating your leadership in this space. Second, move from theory to practice. Lead 2 to 3 major high-visibility AI projects from start to finish. This could be an ambient scribe pilot, the implementation of an imaging AI tool, the validation of a predictive model, or the deployment of a patient-facing virtual agent. Nothing builds credibility like real delivery. Successful projects are the currency of influence. If you're still watching, it means you appreciate this level of depth and detail. That's exactly what this channel is about. So take a moment to subscribe for more weekly physician-led content on the frontier of healthcare AI. Third, become the teacher. Proactively train your fellow physicians and clinical staff. Share clear guardrails and best practices. Publish internal safety guidelines and one-page summaries on your organization's intranet. A great CMAIO is as much a teacher and a communicator as they are a strategist, building the institutional muscle for safe AI adoption. When will this role become standard? For large academic health systems, we expect dedicated CMAIO roles to be common within the next 1 rounds. For mid-sized systems, the timeline is likely 3 to 5 years. And for smaller hospitals, while a formal C-suite title may not exist, the responsibilities of the CMAIO will inevitably be absorbed by the CMIO or another clinical leader. The bottom line is this: the CMAIO function will become as common as the CMIO, and its adoption will happen much, much faster. If you found this guide helpful, please like, subscribe, share it with colleagues who are also navigating this new landscape. And for anyone exploring how AI can be used for safe preliminary triage, I invite you to try the My AI Doctor Symptom Checker, a tool we built with safety at its core, available at app.myaidoctor.ai. Let's close with one final question for the comments. Looking ahead, what single skill do you think a chief medical AI officer will need most to be successful? Is it technical literacy, change management, clinical expertise, or something else entirely? I respond to every comment, and your input is critical for shaping the future of healthcare.